Psychetruth. Life, wisdom.
I'm John Breeding. It's July the 8th, Wednesday, 2015 in Austin, Texas. And I'm glad to be here doing another video with Psychetruth. And this is another one that disappeared from the YouTube collection, and I think it's really worth replacing, and so I want to do that. It's a book review of a book by Peter Breggin, who's a brilliant psychiatrist who challenges the practices of his own profession, specifically the practice of biological psychiatry, and especially the brain-disabling treatments of biological psychiatry. This one of his books is called Medication Madness. Medication Madness. I really recommend it to people. A psychiatrist exposes the dangers of mood-altering drugs, right? Medication Madness, really recommend it. You know, there's a thing in life called that we see the world not as it is, but as we are. We see things that we know to look for, or that we expect to look for, that we've been conditioned to look for, and we don't see things that we don't know about. And so, in this case, you know, we're conditioned to see people's behavior when it's out of line with what we think it should be as possible mental illness, because we're taught over and over again by the doctors, by the drug companies, by the government, by the media, that, you know, disturbed and disturbing behavior is mental illness. That's a propaganda line of biological psychiatry, right? I've talked enough about the fact that there's not any scientific evidence to really justify that assumption, but that's the assumption, right? And so when people go into disturbed or disturbing behavior, you know, they're typically labeled mentally ill and treated with drugs. And the piece of information that Medication Madness really reveals is that further disturbed and disturbing behavior, escalations of disturbed and disturbing behavior, are often the effects of the very treatment, the drugs. And so it's called Medication Madness. Medication Madness is also technically called anosognosia. That's a fancy term for disabling self-awareness. It's like I'm not unaware of myself even when I'm acting kind of weird. That's one of the effects of brain-disabling drugs. And the point is that to the extent that these drugs work, they work by disabling the brain. They don't treat a specific condition because there's no specific condition that's been identified. They disable some function. And if that disabling leads to better accepted behavior or more conformatory behavior, you know, that's considered effective treatment, right? But it disables some part of the brain. And one thing that specifically tends to disable is self-awareness. People become less aware of themselves. They may become less sensitive and empathic, but not really aware of it. Or they may start overriding conversations and talking a lot more. Or they may become less emotionally fluid, but not aware of it, right? In plain speech, we would talk about this as involuntary intoxication. Voluntary intoxication is I get drunk because I want to get drunk, or I get high because I want to get high, right? Involuntary intoxication is I'm taking my medicine the doctor prescribed, but I end up getting intoxicated, and I'm not even aware of it. I didn't do it for the purpose of getting intoxicated, right? Breggin calls it medication spellbinding. The spellbinding is the impeding of self-awareness. It's getting caught in a spell. It's getting in an altered state of mind without realizing it. And that's what these are. They're psychotropic drugs. They're aimed toward the psyche, right? You know, they're aimed toward the psyche. By definition, they're mind and mood altering, right? And they are. So, very important to know about this, you know, because one way to think about it is basically with psych drugs, primarily there's uppers and downers. And there's severe uppers and severe downers, right? You know, so the uppers would be your stimulant drugs, oftentimes also your antidepressant type drugs. And so, you know, with stimulant drugs, you can get a lot of times a more concentrated kind of deal. They're productivity drugs, right? Get off the couch, get to work, focus on those boring papers, get stuff done. Same reason people love coffee, just stronger forms, right? So therapeutic desired effect is, you're more productive, you're up off the couch, you're getting your schoolwork done, right? But what happens, when it goes from alertness and focus to kind of excitability and agitation and restlessness, right? And what happens when it goes from that to more restlessness, right? And aggression, right? One of the most dangerous effects of psychiatric drugs is akathisia, when you see people getting really restless and uncomfortable in their skin and they just can't stand it, and that tends to get interpreted as bipolar or some kind of possible psychosis coming on. But very often it's the effect of the drug, and that's a real danger condition, that akathisia. I can't stand, I feel terrible, it kind of crawl out of my skin. Because with that often comes suicidality, right? So here's some of this. And with the downers, the tranquilizers and the antipsychotics and stuff like that, calm is considered a therapeutic effect. Sedate, maybe. But what happens when it slips over into lethargy and depression and apathy, right? If you don't know to consider that these might be drug effects, you interpret them as further evidence of further mental illness. Medication madness. And by the way, it's not only psych drugs that do this. A lot of regular drugs have psychiatric side effects, so it's always very, very, very important. Because these drugs, different drugs, we're a very drug-oriented society. These drugs are used for children, they're used for adults, they're used for elders in nursing homes, you name it. So when you see something, a change in behavior, first thing you always want to consider is whether it's a drug effect and to really research these things. Right? Just a few more things about Breggin's book, right? Medication spellbinding occurs along a continuum from mild to severe, right? So you can see mild things like a little irritability, a little impatience, or a little tiredness or whatever. Or you can see extreme versions of that, which lead to agitation and aggression and impulsivity, that causes people to go out and do things that are really wild that they would never normally do. Like robbing a store or something, or threatening somebody, right? Or threatening themselves and becoming suicidal when they were never suicidal before. Akathisia, a painful dance of death, the inability to sit still, associated with a compulsive need to move about in an effort to stop the torment, because what you've got going on is neurological irritation and stimulation, and it's just unbearable. It feels unbearable. Very dangerous condition, and it's a known effect, especially of the antidepressants. Real danger condition for suicide. Spellbound individuals fail to perceive the degree of mental or emotional impairment the drugs are inflicting on them. It's an impairment of self-awareness. So if they aren't fortunate to have friends and family around them to see what's going on, it's really tough. They tend to rationalize and justify their drug-induced mental distress, right? They feel they're doing better when in reality they're often not. And they feel compelled to act out, So that's why it's very important for people in general to know about this thing and to watch out. This could happen to your mother or grandmother who's depressed because of her cancer. She's getting chemotherapy treatment. The oncologist prescribes Paxil. Happened to my mom, right? Unbelievable. Your little kid in school has a bad reaction to Ritalin. So the antidepressants can cause suicide. That's very, very important to know. And it also just, by the way, goes into whether these drugs work at all or not, which is worth reviewing. They work about like placebos in general. Depression and suicide are not side effects. They're primary effects. Not just the antidepressants, but of stimulant drugs too. Listen to this extensive review of the literature on stimulant drugs. These are the drugs we're giving out like candy to kids. In some disruptive children, drug-induced compliant behavior may be accompanied by isolated, withdrawn, and over-focused behavior. Zombie-like, somber, quiet, still. Cognitive toxicity, adverse reactions in 40% or more. Right? In the elderly, high rates of tardive dyskinesia with antipsychotic drugs. The book is Medication Madness. The important thing to do, the important point here is to recognize that these psychiatric drugs and other drugs can do this too. Any drug change ought to be really watched carefully. And psychiatric drugs especially disable parts of the brain. They're toxic both physically to different organ systems and cognitively. And a good percentage of people have very adverse reactions. Obviously, some people swear by them. That's the choice of adults. I've always said I'm a libertarian when it comes to adults using drugs. Children, I'm a protectionist. I think it's shame and disgrace to use these drugs with kids. But in any event, they're brain disabling, and they impede self-awareness in general. And you get this medication madness phenomenon in small degrees, like I say, where, and they're called side effects, but they're really not side effects, they're just effects. And so you can get irritability and snappiness, or you can get lethargy and isolation, or you can get extreme versions that end up as suicidality and homicidality, which Breggin profiles some of those cases in his book. The typical solution of psychiatry to someone showing increases in disturbed or disturbing behavior is to add another drug. So you start out on one drug and then another, and pretty soon a kid's on 3 or 4, or not adults on 3 or 4 or 5 or 6 or 7, right? It's very important to recognize that a lot of the behavior may be drug effects. If there's a real risk and a danger going on in the drug in the first place, the more you're on it, the more risk and danger, because they're addictive and you create drug dependency and they're very hard to withdraw from. And then specifically, when you see changes or escalations of any kind of so-called aberrant behavior, if there's a drug been added, that's the first place to look, because a lot of times the simple solution is just to come off the drug, right? Recommendation, if you've been taking a drug for a while, is always to do it very gradually, because withdrawal can be problematic and sometimes dangerous as well. But I really recommend Peter Breggin's work in general, but specifically Medication Madness, very important concept to know about as a protection for yourself and for others. Because once you're way down that road, it's a hell of a lot harder to get out of it than if you recognize it fairly early on. All right. Thank you very much.